Have you ever looked at a piece of fish on your dinner plate and wondered if you're making the right choice for your health? If you're over 60, this question becomes more critical than you might realize. For decades, we've been told that fish is brain food, the secret to a sharp mind and a healthy heart. But here's the shocking truth that most doctors won't tell you. After 60, certain fish that seem perfectly healthy can actually poison your system, loading your body with toxins that accelerate memory loss, weaken your bones, and even increase your risk of heart disease by over 40%. But before you swear off seafood forever, here's the incredible part. 3 specific types of fish have been shown in clinical studies to do the exact opposite. They can actually reverse inflammation, rebuild cognitive function, and strengthen your cardiovascular system in ways that seem almost miraculous. In fact, the #1 fish on our must-eat list has been clinically proven to reduce brain aging markers by 35% in seniors over 70, yet 90% of people over 60 never touch it. Today we're going to expose the 3 fish that are silently sabotaging your golden years, and then reveal the 3 powerhouse fish that could add years to your life and life to your years. This is about more than just dinner choices. This is about protecting your independence, your memory, and your vitality for decades to come. The truth about fish consumption after 60 isn't what you've been told. While younger bodies can process certain toxins and inflammatory compounds more efficiently, our aging systems become increasingly vulnerable. The liver works slower, the kidneys filter less effectively, and cellular repair mechanisms begin to decline. This means that fish choices that might have been perfectly fine at 40 can become genuine health hazards at 65. Recent studies have identified specific fish that accumulate dangerous levels of mercury, PCBs, and other industrial pollutants that directly target the aging brain and cardiovascular system. Even more concerning, some popular fish contain naturally occurring compounds that trigger inflammatory cascades in older adults, leading to joint pain, cognitive decline, and accelerated aging. Let's start with the 3 fish you should completely eliminate from your diet after 60. These aren't just poor choices, they're actively working against your health goals. The 3rd worst fish for seniors is farm-raised salmon. This might shock you because salmon has long been promoted as the ultimate health food. But here's what the marketing campaigns don't tell you. Most salmon sold in supermarkets comes from crowded fish farms where the fish are fed an artificial diet of corn, soy, and synthetic additives. This completely changes their nutritional profile in ways that can harm seniors. Farm-raised salmon contains up to 16 times more inflammatory omega-6 fatty acids compared to wild salmon. For seniors whose bodies already struggle with chronic inflammation, this creates a perfect storm. These excess omega-6 fats promote inflammatory pathways that worsen arthritis, accelerate brain aging, and increase cardiovascular disease risk. But the problems don't stop there. Farm-raised salmon are routinely treated with antibiotics and synthetic colorants to achieve that appealing pink color. These chemicals accumulate in fatty tissues and can disrupt your gut microbiome, the foundation of immune health. A compromised gut in seniors leads to poor nutrient absorption, increased inflammation, and higher infection rates. Perhaps most concerning is the presence of PCBs, or polychlorinated biphenyls, industrial chemicals that concentrate in farm-raised salmon. These compounds are particularly dangerous for seniors because they cross the blood-brain barrier and accumulate in brain tissue. Research shows that high PCB exposure in older adults correlates with faster cognitive decline, memory problems, and increased risk of dementia. The 2nd worst fish for seniors is imported shrimp. Shrimp might seem like a light, healthy protein choice, but imported varieties carry hidden dangers that specifically threaten aging bodies. Most imported shrimp comes from countries with minimal food safety regulations where harmful chemicals and antibiotics are routinely used in aquaculture. These shrimp often contain residues of chloramphenicol, an antibiotic banned in the United States because it can cause serious blood disorders. For seniors whose bone marrow function naturally declines with age, exposure to these compounds can further suppress immune function and increase infection risk. Imported shrimp also frequently test positive for Salmonella, E. coli, and other dangerous bacteria. While younger digestive systems might handle these pathogens, seniors with reduced stomach acid production and slower gut motility are at much higher risk for serious foodborne illness. A bout of food poisoning that might inconvenience a younger person can hospitalize a senior. Additionally, many imported shrimp are treated with sodium tripolyphosphate, a chemical preservative that helps retain moisture and weight. This additive can interfere with calcium absorption, a critical concern for seniors already at risk for osteoporosis. It also adds unnecessary sodium, which can worsen high blood pressure and strain aging kidneys. The worst fish for seniors is king mackerel, also known as kingfish. This large predatory fish sits at the top of the marine food chain, which means it accumulates the highest concentrations of mercury and other toxic metals. For seniors, mercury exposure is particularly devastating because aging brains are less able to clear these neurotoxins effectively. Mercury from king mackerel binds to brain proteins and disrupts neural communication. In older adults, this can accelerate cognitive decline, worsen memory problems, and increase the risk of neurodegenerative diseases. Studies show that seniors with high mercury levels perform significantly worse on memory and cognitive tests compared to those with lower exposure. The cardiovascular effects are equally concerning. Mercury interferes with the electrical conduction system of the heart, potentially triggering dangerous arrhythmias in seniors who may already have underlying heart conditions. It also promotes oxidative stress, accelerating the aging of blood vessels and increasing stroke risk. King mackerel also contains high levels of histamine-producing compounds that can trigger inflammatory responses in sensitive individuals. For seniors managing multiple health conditions, this added inflammatory burden can worsen arthritis symptoms, disrupt sleep patterns, and slow healing processes. Now that we've exposed the dangerous fish lurking in your diet, let us flip the script and reveal the 3 superstar fish that can actually reverse aging damage and boost your health in remarkable ways. The third best fish for seniors is sardines. These small, humble fish pack an incredible nutritional punch that's perfectly suited for aging bodies. Unlike large predatory fish, sardines are low on the food chain, which means they contain minimal mercury and other toxins. But their small size is deceiving because they're nutritional powerhouses. Sardines are loaded with omega-3 fatty acids in the most bioavailable form. These essential fats directly combat the chronic inflammation that drives most age-related diseases. Regular sardine consumption has been shown to reduce inflammatory markers by up to 30% in seniors, leading to less joint pain, better cardiovascular function, and improved brain health. But sardines offer something most fish don't: significant amounts of calcium and vitamin D. The soft, edible bones in canned sardines provide bioavailable calcium that's easily absorbed by aging digestive systems. Combined with their natural vitamin D content, sardines help maintain bone density and reduce fracture risk in ways that supplements alone cannot match. Sardines are also rich in coenzyme Q10, a compound that becomes increasingly important as we age. CoQ10 supports mitochondrial function, the cellular powerhouses that generate energy. As we get older, our natural CoQ10 production declines, leading to fatigue, muscle weakness, and cognitive sluggishness. The CoQ10 in sardines helps restore cellular energy production, leading to improved vitality and mental clarity. The second best fish for seniors is wild-caught Alaskan salmon. Notice the emphasis on wild-caught and Alaskan. This specification is crucial because Alaskan waters are among the cleanest on Earth. and wild salmon have completely different nutritional profiles compared to their farm-raised counterparts. Wild Alaskan salmon contains the ideal ratio of omega-3 to omega-6 fatty acids, providing powerful anti-inflammatory effects without the inflammatory burden of farm-raised varieties. These omega-3 fats, particularly EPA and DHA, are essential for maintaining brain function, reducing cardiovascular disease risk, and supporting healthy aging. But wild salmon offers unique benefits beyond omega-3s. It's rich in astaxanthin, a powerful antioxidant that gives wild salmon its deep red color. Astaxanthin is particularly beneficial for seniors because it crosses the blood-brain barrier and directly protects brain cells from oxidative damage. Studies show that regular astaxanthin consumption improves memory, reduces cognitive decline, and may even help prevent Alzheimer's disease. Wild salmon is also an excellent source of high-quality protein containing all essential amino acids. As we age, protein needs actually increase because our bodies become less efficient at utilizing dietary protein. The protein in wild salmon is easily digestible and helps maintain muscle mass, bone density, and immune function. The number one fish for seniors is mackerel, but specifically Atlantic mackerel, not the king mackerel we warned against earlier. This distinction is crucial because Atlantic mackerel is smaller, contains minimal mercury, and offers the highest concentration of beneficial omega-3 fatty acids of any commonly available fish. Atlantic mackerel contains nearly 4 times more omega-3 fatty acids than most other fish, providing powerful anti-inflammatory and neuroprotective effects. These omega-3s directly support brain health by maintaining the flexibility of cell membranes, improving communication between neurons, and protecting against age-related cognitive decline. Clinical studies have shown remarkable results from regular Atlantic mackerel consumption in seniors. Participants who ate mackerel twice weekly for 6 months showed significant improvements in memory tests, faster processing speeds, and better emotional regulation. Brain imaging revealed increased blood flow to critical areas involved in memory and executive function. The cardiovascular benefits are equally impressive. The omega-3 fatty acids in Atlantic mackerel help maintain healthy blood pressure, improve arterial flexibility, and reduce the risk of dangerous blood clots. For seniors managing heart disease or stroke risk, these effects can be life-changing. Atlantic mackerel is also rich in vitamin B12, a nutrient that becomes increasingly difficult to absorb as we age. B12 deficiency in seniors can cause fatigue, memory problems, balance issues, and even depression. The highly bioavailable B12 in mackerel helps prevent these deficiencies and supports healthy nervous system function. Perhaps most importantly, Atlantic mackerel contains compounds that support cellular repair mechanisms. As we age, our cells become less efficient at repairing damage from oxidative stress, inflammation, and normal wear and tear. The nutrients in mackerel help restore these repair processes, literally slowing down the aging process at the cellular level. The preparation method matters as much as the fish selection. For maximum health benefits, choose gentle cooking methods that preserve the delicate omega-3 fatty acids. Baking, poaching, or light grilling work best. Avoid deep frying or high-heat cooking that can create harmful compounds and destroy beneficial nutrients. When shopping for these beneficial fish, freshness is crucial. Look for clear, bright eyes and whole fish, firm flesh that springs back when pressed, and a clean, oceanic smell without any fishy odors. For canned varieties, choose products packed in water rather than oil to avoid unnecessary additives and inflammatory oils. Timing your fish consumption can enhance the benefits. Eating fish earlier in the day allows your body to utilize the protein for muscle maintenance and repair. The omega-3 fatty acids are best absorbed when consumed with other healthy fats, so consider pairing your fish with avocado, olive oil, or nuts. For seniors taking blood-thinning medications, it's important to maintain consistent fish consumption rather than dramatically increasing intake all at once. The omega-3 fatty acids in fish have mild blood-thinning effects, so sudden increases could affect medication balance. Work with your healthcare provider to incorporate these beneficial fish safely into your routine. The mercury concern that applies to dangerous fish like king mackerel doesn't disappear completely with safer choices. Even beneficial fish should be consumed in moderation. 2 to 3 servings per week of the recommended fish provides maximum benefits while minimizing any potential risks from accumulated toxins. Storage and handling practices become more critical as we age because seniors are more susceptible to foodborne illness. Always refrigerate fish immediately after purchase, use within 2 days, and ensure proper cooking temperatures. When in doubt about freshness, it's better to err on the side of caution. Consider the source of your fish as much as the species. Wild-caught options are generally superior to farm-raised, but not all wild-caught fish are equal. Fish from cleaner waters with better environmental management practices will have fewer contaminants and better nutritional profiles. The cumulative effects of good fish choices compound over time. While you might not notice dramatic changes immediately, consistent consumption of beneficial fish, while avoiding harmful varieties, creates profound health improvements over months and years. Brain function stabilizes and may even improve, cardiovascular health strengthens, inflammation decreases, and overall vitality increases. Don't let perfect be the enemy of good. If you can't always find the ideal fish choices, focus on avoiding the worst options first. Eliminating farm-raised salmon, imported shrimp, and king mackerel from your diet will provide significant benefits even if you can't always access the best alternatives. Budget considerations don't have to derail healthy fish choices. Canned sardines and Atlantic mackerel are among the most affordable fish options while providing the greatest health benefits. Fresh wild salmon might be expensive, but frozen varieties often provide similar nutritional benefits at lower costs. The transformation possible through strategic fish selection goes beyond individual nutrients. Fish consumption affects the entire inflammatory cascade in your body, influencing everything from joint comfort to sleep quality to immune function. By choosing wisely, you're not just eating dinner, you're actively participating in your own healthy aging process. Remember that fish is just one component of a healthy senior diet, but it's a uniquely powerful one. The combination of high-quality protein, beneficial fats, and specific nutrients found in the right fish choices cannot be easily replicated through supplements or other foods. Your fish choices today directly impact your independence, cognitive function, and quality of life in the years ahead. The toxins from harmful fish accumulate over time, while the benefits from beneficial fish compound to create lasting health improvements. This isn't just about feeling better next week, it's about protecting your future self. The science is clear, the choices are straightforward, and the benefits are profound. Eliminate king mackerel, imported shrimp, and farm-raised salmon from your diet. Replace them with Atlantic mackerel, wild Alaskan salmon, and sardines. Your brain, your heart, and your entire body will thank you for decades to come. The power to age successfully is literally on your plate.